question that's kind of interesting. It just is very basic and says, what are the different types of testosterone I could take? And I think that's a good question because there are a lot of options out there. Used to be there was only one or two. Now we have more options for people. But normally people will typically use injections, and that is either in the buttocks or in the thigh if they give it to themselves. And there's also gels and creams that are out there. They also have implantable pellets as far as typically put them in your buttocks. There's also patches out there as well as oral tablets. So now there's more options for people. What I found that people like the best are the injections and the creams. Those are the main two that people kind of have a tendency to gravitate towards. They like the injections because it's quick, it's easy, it's once a week. Sometimes they'll do 2 or 3 times a week, split the dose so they have more even levels. Sometimes they don't like the jagged up and down of the levels that you get once a week. And so I understand as far as giving it 2 or 3 times a week, especially if they don't have a aversion to needles. Gels and creams are out there. I typically don't use the pharmaceutical gels because typically they're not strong enough or potent enough. They're usually like a 1% gel in an alcohol-based and typically aren't strong enough to really get your levels up. I'll use creams from compounding pharmacies where they can go up to even 20% of testosterone in a cream. Those typically work well. The nice thing about creams is you can get that level where it's nice and level throughout the entire day, and you really don't have the drops that you get with some of the injections. And so the creams are a little bit more expensive, and the injections are typically $3-4 a week. The creams are roughly $40 to $60 a month. And so, but the creams give that added nice level throughout the day that's even. There's also pellets. You can get those. Those are injectable. They typically inject them into the buttocks, and they're a little bit more expensive. When I've looked and researched, it's anywhere between $300 and $700 a quarter, and then once they're in, they're in, and then they're absorbed. I typically don't use the pellets. Simply because they last for about 4 months. If you don't get the right dose, then you can have problems with patients and wanting more, wanting less. And the other thing is they have a linear absorption rate. So they're absorbed at just a steady rate. The only problem is in the first 2 months, you can be super therapeutic, and then in the last 2 months where you have to wait to get more pellets, you can be subtherapeutic. I've had patients that have come in and they do really well on pellets for the first 2 months. And then they are sucking wind because they feel they've got no energy, they're fatigued, and so they've got to wait 2 more months to get their pellets again. These patients that I've found have done much better on injections and gels, or injections and creams, rather than the pellets. But it's an option. Some people love them, and so that is an option. There's also patches out there. I haven't used too many patches just because they're not as strong and potent as you can get with the injections or the pellets. And so the other option other than the patches is also pills. And with pills, they've really had to watch that because it goes through the liver, and liver can get have some problems with the pills. There are some newer things out there that they'll take, and they're not considered a testosterone, but they're similar to it, and that's still not even FDA approved. And so we've got a number of options at a number of price categories, and so typically what I see people do the best on is injections or the creams. I'm Dr. Guy Dom. Check me out at armurmedical.com, and if you have any questions, just hit us up at the email address on the screen.